What's up guys, it's Amir, and today I want to talk to you about the difference between oral minoxidil right here versus the topical version and the pros and cons of each and which one I think would be the best for you based on your own hair loss situation. I've had my fair share with both of these treatments and I've personally been on minoxidil myself for about almost 6.5 to pushing 7 years now. And if you're considering this treatment for hair loss, I want to give you my 2 cents on it so you can make an educated decision after watching this video. Before we start, I'd like to thank the sponsor of today's video, Vera Clinic. Vera Clinic is where I got my hair transplant done from. If you're looking for a quality, trusted professionals who can get you long-lasting and natural-looking results for a fraction of a price, look no further than Vera Clinic. They got me these amazing results for my own hair transplant, and I would highly recommend them to anybody looking to get their own transplant done, especially overseas. If you want to check out my series of my hair transplant, where I filmed the whole surgery and everything, as well as my month-by-month recovery, I'll leave a link to that whole playlist in the description below, as well as the contact information for Vera Clinic so you can contact them for your own hair transplant needs. That being said, let's jump right into the video. So let's talk about oral minoxidil. That's been kind of the new phenomenon for the past few years. I've seen a lot of YouTubers, even doctors on YouTube, have been pushing this as a treatment for hair loss. Before we jump into whether it is the superior option to topical, it's important to understand what minoxidil truly is. Minoxidil was developed back in the 60s or 70s as a treatment for patients with high blood pressure. Once those patients started taking the pills and it was helping them with their blood pressure issues, they also realized that a side effect of it was that they were growing hair. Based off of that, topical minoxidil was born, and over the years, definitely the Rogaine brand has been the one that caught the household name for minoxidil. Instead of actually consuming the pill for those who are not patients of high blood pressure, they said it would be a better idea to simply apply topically in the area of concern where you simply just want the hair loss without actually trying to treat a symptom that you don't really have. The reason why minoxidil works so well for hair growth is because it's a vasodilator, meaning that what it essentially does is starts promoting blood circulation, and in the dormant areas of your hair loss where there's a lack of blood circulation, that's when the hair loss occurs. And by simply stimulating that area with blood, essentially you're stimulating hair growth, and by keeping up with it on a consistent basis for at least 4 to 6 months, that's when the users of this treatment start seeing some results. And obviously you have to use it for a continued amount of time if you want to keep those results. So personally myself, I started off with the household name, the Rogaine brand, back in 2016, and I was using topical minoxidil on and off for the past, I want to say, all the way up to 2022. And then I saw a big push towards the oral version, and people were saying that it was a lot more convenient and potentially even more effective because they don't have to take time out of their day to, go in the bathroom and apply this treatment every single day. They just go ahead and pop one of these tabs and they're good to go. And since I already took finasteride, this would be extremely convenient for me because all I had to do was take a small pill of the minoxidil and a small pill of finasteride and I was good to go. It literally took like 2 seconds to do. So I decided it would just be a lot more convenient. But do note, whether you get the 5 milligram or the 2.5 milligram, you can't take the whole pill. That is gonna really mess you up. If you are considering it, you have to get one of these things that I got. This is like a pill cutter. You have to break it up into these tiny 0.25 to 0.5 milligrams, which is the optimal amount to induce hair growth without risking the side effects, especially if you're not a patient of high blood pressure. So this is generally well tolerated, and a lot of dermatologists actually even started prescribing their patients with oral minoxidil, and people seem to be responding fine with it. But that wasn't the case for me. I started taking this for about a week, and then I immediately started noticing side effects for myself. I was having shortness of breath, constantly started to feel a little bit dizzy. My blood pressure was starting to get pretty low, and honestly I just didn't feel like myself, and I felt like something was off. And I believe that was my body rejecting the minoxidil, actually getting side effects for something that I shouldn't be taking, that's not meant for my health. And that's when I decided, like, it's not worth me risking going even further, pushing it. And a few days later my side effects were completely gone, and I just switched back to the topical version and I was completely fine. Another thing to note is that with oral minoxidil, it doesn't just work with the area that you're balding. This works with hair growth pretty much all over your body. So if you're already a hairy person, it's gonna make you a lot more hairy, meaning that you're gonna have to do a lot more upkeep with your regular manscaping and grooming around your entire body. That's also another thing to keep in mind, as well as the fact that for something like this, there is a prescription required, whereas for something like Rogaine, or even if you get our own brand of minoxidil from Growplex, these are all over-the-counter medication. So you can just go to your local Walmart or just go on our website and order it right there. But for something like this, you're gonna have to go to a doctor and actually get it prescribed and go to a pharmacy and pick it up. Now, it is a bit more of a hassle because it's recommended for you to use twice a day for the best results, but due to the half-life factor of it, you can actually get away with just using it once a day and you'll be just fine. And since it doesn't enter directly into your bloodstream like a pill, it has less chances of giving you any systematic side effects. And after almost 7 years of using this treatment, I think that it definitely does take a little bit more effort, but when paired with a habit that you already do, it makes keeping up with the consistency a lot easier. So for example, you know, I brush my teeth twice a day. I paired the habit of me brushing my teeth followed by just using minoxidil on my head, and eliminates the day-to-day friction of like, oh man, I have to go and like, you know, apply this on my head. Another thing is, yeah, obviously we know that oral minoxidil is great for treating hair loss, but what we do know after thousands of case studies is that pairing topical minoxidil with something like derma rolling, or even if you use the electronic derma pen, can increase the results up to 3 to 4 times more than just using topical minoxidil alone. By pairing it with a derma roller, you're directly getting to the root cause of it because you're making like these tiny micropunctures on the balding area, which is stimulating collagen, protein, and opening up those wounds, which gives you a lot better hair growth, as well as the added benefits of the protein and collagen getting stimulated on your scalp. I would argue it's a lot more well tolerated and can get you better, more promising results than using oral minoxidil. Overall, it depends on your lifestyle, your tolerance to each treatment, and most importantly, which one you can stick to consistently for the years to come, because there is no real cure for hair loss, there's just treatments, right? So you want to be able to keep up with these treatments for as long as possible for you to be able to not just hold on to the hair, but even regrow hair. One of the mistakes I made with oral minoxidil is I just went to an online pharmacy and answered a few questions, and they prescribed it to me pretty easily without taking my vitals, without checking my blood pressure, or any of those things. And I think those are the things that are needed to ensure that you are really a good fit, instead of doing a trial and error game, which in the long run can be a big risk to your health. So instead, if you're considering this, actually going to a doctor, make sure your vitals and everything are actually good, so that way you can reduce the chances as much as possible of you experiencing any side effects from a drug like this. Regardless, in my personal opinion, you can't go wrong with the topical option paired with a derma roller. That I think is probably gives you the best of both worlds and even gets you better long-term results. So yeah, these were my 2 cents on the whole oral versus topical minoxidil. Let me know which one you're considering and which ones that you have tried and what your experience has been so far. But I hope this video gave you a little comprehensive overview on both and helped you make an educated decision on yourself on which one you should use. I hope you enjoyed this video. I'll see you guys in the next one. Peace.